Mm. Good morning all. I am going to present paper on choroidal vascular and morphometric changes after intravitreal aflibercept injection in polypoidal choroidal vasculopathy. Coming to introduction, polypoidal choroidal vasculopathy is one of the commonest exudative maculopathy that we see in our day-to-day practice. Our diagnosis is mainly based on typical clinical findings including reddish-orange subretinal nodule and subretinal hemorrhage. OCT findings suggestive of PCV are thumb-like elevation of the retinal pigment epithelium, notched PED and double layer sign. Diagnosis is mainly confirmed by ICGA findings like nodular hyperfluorescence, branching vascular network of inner choroidal vessels and hypofluorescent halo. Aflibercept is a newer anti-VEGF molecule which act against both VEGFR1 and VEGFR2. Coming to management of PCV, treatment response of PCV is currently based on demonstration of intraretinal fluid or subretinal fluid reduction on OCT and obliteration of polyps on ICGA. But as ICGA is an invasive procedure, it is not universally available. Recently, new choroidal indices like subfoveal choroidal thickness and choroidal vascularity index have been described by various authors. Study of these changes in these indices after treatment would be a surrogate for assessing the treatment response. Coming to aim of our study, to investigate changes in subfoveal choroidal thickness and choroidal vascularity index after intravitreal aflibercept injection for PCV. Coming to materials and methods, it was a retrospective study. Study was conducted in a tertiary eye institute in South India. Study period was January 2023 to July 2023. Study subjects were 34 eyes of 33 patients. ICGA diagnosed PCV eyes were included in our study. We have used OCT on Heidelberg spectralis, spectral domain OCT. Loading dose of aflibercept, standard dose was given. Choroidal changes analyzed at baseline and after 3 injections. Monthly 3 injections were given and 1 month after injection we have again analyzed subfoveal choroidal thickness and choroidal vascularity index. Now, how to measure subfoveal choroidal thickness? For measuring subfoveal choroidal thickness, we have used caliper tool, and using caliper tool, vertical distance was measured from hyperreflective layer of retinal pigment epithelium to reflective layer of choroidoscleral interface. Now, how to measure choroidal vascularity index? For measuring choroidal vascularity index, we have used a newer software known as ImageJ software. First of all, we have exported the original OCT image into ImageJ software. Then we have used an algorithm known as NIBLAC algorithm. Using NIBLAC algorithm, we have binarized the original OCT image. Then we obtained an 8-bit image. This obtained 8-bit image was seen in this picture. Binarized image is image in which we can see dark and white areas, and the dark areas represents the luminal area and the white areas represent the stromal area. Then using the ImageJ software itself, we have analyzed the image and we obtained stromal choroidal area. Then 100 minus stromal choroidal area, we will get the luminal choroidal area. Actually, choroidal vascularity index is total luminal area by total choroidal area. Coming to results of our study, majority of the patients in our study group were male, and most of the patients in our study group came in the age group of 71 to 80 years. Most of the patients had 1 line improvement. In our study, there was a reduction of subfoveal choroidal thickness from 388.9 to 333.1, which was statistically significant. In our study, we have also obtained reduction of choroidal vascularity index from 63.1 to 61.8, which was also statistically significant. When we are discussing about subfoveal choroidal thickness, previous reports demonstrated that subfoveal choroidal thickness decreases significantly after intravitreal injections of ranibizumab and aflibercept, while others did not find any significant change after bevacizumab and ranibizumab. However, our study found a significant reduction of subfoveal choroidal thickness after 3 months of treatment of aflibercept. When we are discussing about choroidal vascularity index, studies have shown that aflibercept in comparison to ranibizumab decreased choroidal vascularity index better in neovascular AMD, but these studies have excluded PCV. Our study found that PCV eyes also demonstrated reduction of choroidal vascularity index after aflibercept therapy. There is not enough literature in PCV eyes treated with aflibercept. Though it was observed that aflibercept was a better agent than ranibizumab in PCVI in terms of vision gains and retinal drying, demonstration of choroidal vascular changes have been inadequate in previous studies. Our study demonstrated that aflibercept decreases choroidal thickness in these pachychoroid eyes by decreasing the dilated choroidal vessels and thereby reducing the intraretinal fluid, subretinal fluid, and sub-RPE fluid in these patients. When we compare choroidal vascularity index with subfoveal choroidal thickness, choroidal vascularity index is a better parameter because it is not influenced by age, axial length, IOP, and time of day. Coming to conclusion, response to aflibercept in PCVIs could be gauged by non-invasive imaging like change in choroidal thickness and change in choroidal vascularity index. Choroidal thickness in PCVI significantly decreased after intravitreal aflibercept injection. Aflibercept treatment also showed decreased choroidal vascularity index changes. These are my references. Thank you. To measure the central choroidal thickness change after aflibercept injection, we have analyzed the central choroidal thickness and choroidal vascularity index. Monthly 3 injections were given and baseline investigations done, and after that we have given 3 monthly injections, and 1 month after injection we have again analyzed OCT changes. All patients we have equal number of injections were given to all patients. 3 injections were given.
Baseline index before you started these patients, and then like all of them were similar kind of patients, or some of them had more? Was there any matching that way?
Baseline as a baseline we have fundus examination were done, OCT taken, and subfoveal choroidal thickness. Before injection we have also taken the subfoveal choroidal thickness and choroidal vascularity index. ICGA was done.
No, all of them were showing some bleeding at the central state. This thing probably, no?
Yes.
Why did you do this injections? Because IPCV was having some complications in the retina, I suppose.
Yes.
Yes or no?
Yes.
So what was that? If there was blood there, that thickness would be also affected. None of these patients had retinal thickness increase, only choroidal.
Some of the patients had retinal thickening improvement also.
No, what I'm... Yeah, because if there is blood there, this thing will not be the imaging which you're talking about. You will not get. So how will you assess? So if there was no blood, then why did you inject? That was my question. Don't worry. We know it's not. Just asking you because I am a little interested in your software, but
retinal thickening was increased in some of the patients.
did you get this beautiful image which you showed?
We have analyzed the some of the patients had increased retinal thickening. In that patients, we have analyzed the subfoveal choroidal area of 3000 micrometer from the using the caliper tool, and using the polygon tool we have marked 3000 micrometer area of that lesion only. Then using the software we have calculated the stromal area. In choroidal vascularity index is the value. Yes, pre and post. Thank you.